So, looking at the veins, first off, pressure in the veins is a lot lower than what's going to be in the arterial system. So, the largest artery is the aorta, coming off right the heart. Peripheral venules, so those smallest veins coming off the capillaries, is less than 10%. So, the pressure drops a lot when it's going to the venous side. So we need extra ways in which blood can go travel through the veins in back to the heart. Because you imagine we're going from the feet and going back to the heart, that's a long distance. And if there's not much pressure to drive it up towards the heart, then we have to have other mechanisms that'll help move blood throughout your veins. First difference that veins have that arteries do not is valves within them, so internal valves. So it's actually folds of that inner layer, the tunica intima, that actually kind of moves into the vessel wall and actually points in the direction of blood flow. So what does that mean? So there are little valves that kind of go like this, and they would be if blood flow is going that way upwards. So you can imagine if blood's trying to go back, it's going to push on that valve and close it. Same that way. So it makes sure that blood is flowing in one way towards the heart because it can't go backwards. So it has to stay there. And then it has another valve up here and same thing. So it's like climbing the steps. So it gets up one step and then it can't go backwards. And then it gets up another step and it can't go backwards. So these internal valves help make sure blood's going one way to the heart and it's not going backwards. Another major component of moving blood is actually contraction of skeletal muscles. So that's why they say, especially you don't want to sit around too much, get up, get your blood flowing. That is true, at least getting blood moving through your veins. So you can imagine, especially in the legs, there's large veins or large muscles, skeletal muscles. The veins are going to go kind of in between them. So as you're contracting a muscle, basically what happens is it squishes this vein right here. So it's like squeezing a tube with toothpaste. If you squeeze in the middle, it pushes more up there. Plus you have the valves that prevent the backflow. So it makes sure that it's going in one way. So it's putting pressure on it and squeezing up. And then you have the valves, and then you have another muscle, and it's going to squeeze and push up. So it's kind of just like this little squeeze mechanism to help blood go back to the heart. So same thing, just kind of talked about it. Contraction of the skeletal muscle squeezes the veins. So like squeezing on a tube of toothpaste pushes it out. Then the valves make sure that it's going in one direction and that there's no backflow. If the valves in the veins are not working properly, so there's something wrong with them, blood can actually pool in the veins and cause them to be distended or enlarged. Because you imagine if you're not having those mechanisms where the valves can close, then you can have blood that's just going to sit in some area of the veins and it's going to pool there because it's low pressure. So there's not enough to help it move along. Even skeletal muscle, it's going to squeeze. So some can go up, but some can go back down. So it's just going to be a sloshing effect without the valves, making sure that it goes in one direction. So you can actually get the distension. So some of it's mild, it actually looks kind of ugly. And those are varicose veins. So if you see varicose veins in legs and thighs, it's because of valves in the veins not working properly. You can also even have painful ones where the distension is so severe that it actually affects the tissues around it and causes pain. So hemorrhoids is a painful condition where the veins around the anal canal get really distended and enlarged, and they put pressure on the anal canal and the tissues around it, which causes the pain. So just showing you better picture of the valves. So this is the valve looking. So it's going to be open superior, the contracting muscle. So contracting muscle, valves are closed. You squeeze the muscle in to push blood. It forces the valve open and moves upwards. But the one below the contracting muscle area is going to be closed because blood's going to force it closed. So it can't go down towards the foot, it can only go up towards the thigh. Another thing about veins is kind of where blood sits. So there's actually not an even kind of distribution or arrangement of blood that's in the arteries, veins, and capillaries. There's more blood in the veins than anywhere else. So 64% of all of your blood is actually sitting in your veins. About a liter of that is going to be blood that's going from the digestive system to the liver. And we'll talk about that, why that is more when we get to the digestive system. So it is a blood reservoir, meaning it's hanging out and storing blood in case you need it. So if bleeding happens, that's why we can lose a lot of blood and still survive because we have kind of a storage unit in our veins. Just a graph, so 64% is in veins, about 9% is going around to your lungs, 7% is the heart, 13% is actually in your arteries, and then 7% is where your capillaries are. So significant amount is in your veins. So now looking at capillaries, so remember just having a layer of endothelial cells, so very thin, just simple squamous endothelial cells with a basement membrane. They don't have the media or the externa tunicas. They are very, very small. So they are about the same width of a red blood cell. So red blood cells, part of their kind of stacking shape, remember they kind of are indented in the middle where they can stack on top of each other. That's so that they can flow through these really thin capillary wall, thin, tiny lumens of the capillary. So tiny opening. There's two major types, continuous and fenestrated, which we'll talk about next. Continuous. The endothelium is continuous. That's the name. So the endothelial is a complete lining, meaning there's no holes in it. So this is everywhere. You don't see this in epithelial or cartilage. That's where you don't really have vasculature, blood vessels anyways. This allows diffusion of water, small things, and lipid-soluble materials. So it's everything that's going around the cells. So you have the simple squamous. So water and small solutes can kind of go through the cells in a kind of a limited capacity. Lipid-soluble things can go right through the cells easily, or they can kind of go around the cells. So continuous is diffusion can occur, but we're making sure that most of the things are staying inside, at least the larger things are staying inside the blood. So continuous one, you don't have blood cells can't get out, there's not enough holes. So it's only small solutes and lipid soluble materials. Oxygen and carbon dioxide are lipid soluble, so they can move past here. Water, all of those things. There is some selective vesicular transport. So remember, we can have vesicles that go through the cell to transport certain materials. So the cells can have endocytosis and then exocytosis on the other side. So there is some vesicles that'll hold things, but they can either go through the cell or kind of around the cells in certain capacity. There's also specialized continuous capillaries in the central nervous system, and that's actually the thymus. So this is going to be where there's no space between the endothelial cells, meaning that there's a tight junction. There's no way of getting around it. That is making sure that everything has to go through the cell and we can regulate and determine what's going inside. So this is important for the blood-brain barrier so that we can decide what's coming in our brain. Not barrier. So what we can decide that's coming in our brain. The thymus is another thing because we'll talk about the thymus when we get to the immune system. The thymus has T cells in it, and we want to kind of sequester them separate when they're maturing and things like that. So there's a thymus berry as well. Next type of capillary is fenestrated, so it has little pores. So there is pores that are in the lining of the capillary or the endothelial lining. So it's poked holes. So all these little pores in it are going to allow more things to flow through. So not only do you have more water, because more water can go through, but also larger molecules can go through. So they don't depend on going through the cell or around kind of the little area between cells. They can go through larger doors or fenestrations that'll allow movement of things a little easier. So these are a lot more permeable. So they allow a lot more materials to exchange. So where do you see fenestrated capillaries? At least an example. You can see them a lot of places. Choroid plexus of the brain. So this is a little different. So where CNS kind of or cerebral spinal fluid is going to be made. Capillaries, these are all endocrine glands. So where you're making hormones and being able to release them, areas where you have absorption in your GI tract is going to be important. You're going to have larger molecules coming in from your digestive system that need to be absorbed, and also in the kidney as well. Sinusoids are the last type of capillaries. So these are going to be fenestrated, but so they're going to have large holes, but oftentimes they're kind of not as well arranged. They can be flattened and kind of abnormally shaped. But they have larger gaps even. So not only do you have kind of pores, but we have even larger gaps between it. So we can allow even more exchange, and these larger gaps can have larger molecules go through it as well. So sinusoids, everything's more. So plasma proteins, which everywhere else you don't want plasma proteins to go out of the capillaries. We'll talk about why later. But where we need exchange of plasma proteins, especially in the liver where plasma proteins, a lot of them are made, bone marrow where a lot of red blood cells are made and white blood cells, so we need exchange for that. In the spleen where a lot of red blood cells are and white blood cells are stored. And then also even more of the endocrine glands. If they're making hormones, it's a large protein. It needs to be able to leave the capillary and go into circulation or get into the capillary. So it goes both ways. So a capillary bed, what we talk about is going to be the network of capillaries. So all these little vessels make a little net or kind of all combined in all over the place. So we have a lot of connections between arterioles, which is going to be the artery side, and the venules, which is going to be the venous side. So remember, arteriole comes in, has a bunch of capillaries, so the capillary bed, and then it exits the venule side. So we have a lot of connections between these two sides. So many of the capillary beds can actually be supplied by more than one artery. So what can happen is arteries can kind of come together and fuse before they are going to lead to arterioles, which lead to capillary beds. So multiple arteries can come in and kind of fuse together and then lead to the arteriole, which is going to lead to the capillary bed. When we fuse anything together with blood vessels, it's called, or pretty much anything in medicine, is an anastomosis. So that's just saying that you have a connection or a fusion of blood vessels here. This is good thing because say if this is coming down to an arteriole that leads to a capillary bed, well, if you for whatever reason are blocking this blood vessel, well, you still have blood coming down from this blood vessel. It's not as much, but at least it's something. So if one artery for whatever reason is blocked or squished and blood's not flowing through it, the capillary bed and all these tissues are not dying because they're still getting oxygen and nutrients. So there is areas of the capillary bed that we can just go through it. So you have an arteriole coming in and you just have this, and then it goes to a vein, a venule. So you have kind of the rest of the capillary bed out here. This is called an arteriovenous anastomosis because there's a joining between the artery side, which is this side, and the venous side, which is this side. So sometimes, for whatever reason, there's different times and that you just want to skip a capillary bed, so you don't need blood supply or as much blood supply. Say if you're resting, you don't need as much blood supply to your skeletal muscle, then you're just going to go the highway past the capillary bed instead of taking all the back roads, which is the capillary bed. So specifically an arteriole that's leading to a capillary bed is either called a met arteriole or precapillary arteriole. That's going to be arterial side of kind of the beginning of the capillary bed. The precapillary arteriole does have smooth muscle that can change the vessel diameter, meaning it can constrict or dilate, which is going to adjust the flow rate. Because if you dilate this precapillary arteriole, then more blood's going to be able to flow through. If you constrict this precapillary arteriole, then less blood's going to go through and go into the capillaries. So it's another control mechanism. If you don't really need a lot of blood supply going to specific tissues, then you can shut it down or at least reduce it. So the thoroughfare channel is going to be the arteriovenous um, uh, anastomosis. That's going to be where it can just go directly through. On top of having the arteriole being able to constrict and dilate, we also have what we call precapillary sphincters. This is sphincter is going to be a circular part of smooth muscle, and it is going to be able to also help control flow into the capillary bed. So you have the thoroughfare, and then you have a bunch of capillaries coming off of it. Well, you can have precapillary sphincters all here that can open and close and allow blood to move through. So at any time, actually 75% or 3/4 of your capillaries are actually shut down. So they're constricted at the arterioles, um, and the precapillary sphincters are going to be closed as well. So we kind of redistribute blood where we need it based on what's happening and what's happening in your body. So say you're exercising, you need more blood to your skeletal muscle and you need less blood to other areas. So you'll kind of redirect it by using this mechanism, at least partially. So when the precapillary sphincters are relaxed, then the capillaries have all the blood and the arteriole is going to be relaxed as well. Then you're going to have more blood. If there's constriction of the arterioles, less blood's coming to the capillaries, and the precapillary sphincters are closed, then they are not going to allow blood to go to the capillary bed, and it's going to go through that thoroughfare. So it's going to go to the arteriovenous anastomosis. It's going to go right through on the highway. All the roads to the back roads and the rest of the roads are blocked by the precapillary sphincters. So one way to go, only way to go to the venous side. So it's going to skip all of this where exchange of nutrients and oxygen and carbon dioxide and waste would happen. So better picture than what I'm showing. So this is showing you the arteriole. This is having an anastomosis, so you're coming together. So you have arteriole coming down, and then the beginning part of the thoroughfare or the anastomosis is going to be the metarteriole, and then these are all your precapillary sphincters. So open arterioles, open sphincters, then all the capillaries are profuse. So blood's going all the way through. And then it goes to the venous side, going to the venule. If you have constriction of these precapillary sphincters, then blood's just going to flow on by. So you can see the difference where it's not going into the capillary bed. So, like I said, if you're not using your skeletal muscle because you're resting, then you're just going to bypass. It doesn't need as much oxygen and nutrients as if you were exercising and moving.